Have you ever wondered how common erectile dysfunction really is? Today we're diving into this subject and breaking down the causes of erectile dysfunction, or ED, in a way that's easy to understand. Erectile dysfunction is categorized into two types, primary and secondary. Primary ED is quite rare and occurs when a man has never been able to attain or sustain an erection. This is almost always due to psychological factors or clinically obvious anatomical abnormalities. Secondary ED is more common, with over 90% of cases having an organic etiology. This type is acquired later in life by a man who previously had no trouble attaining erections. Quite often, men with secondary ED develop reactive psychological difficulties that compound the problem. Psychological factors, whether primary or reactive, are a critical consideration in every case of ED. These causes may include guilt, fear of intimacy, depression, or anxiety. For secondary ED, the causes can relate to performance anxiety, stress, or depression. Psychogenic ED may be situational, involving a specific place, time, or partner. Now, let's talk about the major organic causes of ED. These are typically physiological and can include vascular and neurological disorders, often stemming from conditions such as atherosclerosis or diabetes. The most common vascular cause is atherosclerosis of the penis's cavernous arteries, often caused by smoking, endothelial dysfunction, and diabetes. Aging and atherosclerosis can decrease the capacity for dilation of arterial blood vessels and smooth muscle relaxation, limiting the amount of blood that can enter the penis. Neurological causes can include stroke, partial complex seizures, multiple sclerosis, peripheral and autonomic neuropathies, and spinal cord injuries. Surgical injury and diabetic neuropathy are particularly common causes. Complications of pelvic surgery, hormonal disorders, drugs, pelvic radiation, and structural disorders of the penis can also cause ED. Any endocrinopathy or aging with testosterone deficiency may decrease libido and result in ED. However, erectile function only rarely improves with normalization of serum testosterone levels because most affected men also have neurovascular causes of ED. In conclusion, erectile dysfunction is a complex condition with various causes, both psychological and physiological. Primary ED is rare and usually tied to psychological factors, while secondary ED is more common and often has a physiological cause. Understanding these causes is the first step towards finding effective treatment and managing this condition. Remember, if you or someone you know is struggling with ED, it's important to consult with a healthcare professional. They can provide the necessary guidance and treatment options tailored to each individual's unique situation.